Hello everyone. Today, we're diving into the world of a medication called teriparatide, commonly known by its brand name, Forteo. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Teriparatide, recognized by its brand name Forteo, is an injectable medication that belongs to a class of drugs known as parathyroid hormone analogs. It is primarily used to treat osteoporosis in postmenopausal women and men who are at high risk for fractures. It works by stimulating bone formation, increasing bone mineral density, and improving bone strength, thereby reducing the risk of fractures. Forteo is also prescribed for individuals with osteoporosis associated with sustained systemic glucocorticoid therapy. Approved by the FDA in 2002, it is one of the few treatments that directly promotes new bone formation. Warnings: Teriparatide comes with specific precautions. It's not recommended for individuals with bone cancer or those who have had radiation therapy involving the bones due to an increased risk of osteosarcoma. It's also contraindicated in patients with hypercalcemia or elevated levels of calcium in the blood. Those with a history of skeletal malignancies or other metabolic bone diseases, except osteoporosis, should exercise caution before taking this medicine. Before starting teriparatide, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug or any of its ingredients. Given its impact on bone formation, those with bone diseases should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. It's also important to inform your doctor if you have a history of kidney stones, as teriparatide can increase calcium levels in the blood, potentially worsening this condition. You should not take teriparatide if you have certain bone disorders, bone cancer, or have undergone radiation therapy involving the bones. Inform your doctor if you have Paget's disease, unexplained high levels of alkaline phosphatase, or if you have any metabolic bone diseases other than osteoporosis. If you are scheduled for surgery or certain diagnostic tests, inform your doctor as you might need to stop taking teriparatide temporarily. Side effects: All medications can have side effects, and teriparatide is no exception. Common side effects include nausea, dizziness, leg cramps, and pain at the injection site. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Additionally, some individuals might experience hypercalcemia, characterized by symptoms like muscle weakness, confusion, fatigue, and increased thirst or urination. There's also a potential risk of orthostatic hypotension, leading to dizziness or fainting upon standing. Teriparatide may cause serious side effects including hypercalcemia, which can manifest as muscle weakness, fatigue, confusion, increased thirst or urination, and abdominal pain. If you experience symptoms of high calcium levels, contact your healthcare provider immediately. Other serious side effects include allergic reactions, characterized by swelling of the face, lips, tongue, or throat, difficulty breathing, and severe dizziness. If you notice signs of an allergic reaction, seek medical attention promptly. Furthermore, there is a potential risk of developing osteosarcoma, a rare but serious bone cancer. Though the incidence is low, it's important to be vigilant about any unusual bone pain and report it to your doctor immediately. Interactions: Teriparatide might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Dosage: Correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking teriparatide. The recommended dose is 20 micrograms administered once daily via subcutaneous injection in the thigh or abdomen. Treatment duration is typically limited to 2 years due to the potential risk of osteosarcoma. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. Never alter your dosage without consulting your healthcare provider. Avoid: While on teriparatide, it's advisable to stay hydrated to prevent dehydration. Given the potential for dizziness, it's wise to rise slowly from sitting or lying positions. As with many medications, it's recommended to avoid alcohol, as it can exacerbate certain side effects. FAQ: Many wonder about the age restrictions for teriparatide. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of teriparatide. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.